Welcome back, dear viewers. And today, or this evening, we are joined by Dr. Alyaa Farouk, specialized in dermatology. Good evening to you, Dr. Alyaa. It's such a pleasure to have you here on Hala Kuwait.
I'm happy also to be here in Kuwait.
That's really nice. And Dr. Alyaa, behind the scenes, you told me a little bit that you came recently to Kuwait. So would you tell us a little bit about yourself?
I'm Dr. Alyaa Farouk. I'm a specialist of dermatology. I have an experience in dermatology and cosmetology for more than 10 years. I have a master's degree in dermatology at Shams University, also PhD in lasers at Cairo University. I have been in Kuwait for 1 year. That's all.
That's really great. And Kuwait, doctor, is your second home here. You're most welcome. And I'm sure us and our dear viewers will be glad to hear some of your insights and experiences.
Thank you.
You're most welcome. Therefore, doctor, we'd love to know all about Botox. And what is Botox, really?
Botox simply is a simple cosmetic procedure targeting the muscles of the face, causing their relaxation by decreasing a chemical substance called acetylcholine in order to treat wrinkles in areas like forehead, between and around eyes. Okay. This is the most common and known use of Botox, but it has other uses like treating gummy smile, elevating tip of the nose, treating chin dumpling, treating paroxysma, and finally treating the longitudinal lines of the neck.
All right. So, doctor, does this only apply to females, or do you have male patients also?
Also males can benefit from Botox, especially they have powerful muscles and the wrinkles develop earlier.
All right.
That's why it's very beneficial to men.
Okay. And wrinkles, doctor, just comes from time or age, or what does it come usually from?
From expressions, especially athletes who use the muscles excessively. Yes.
All right. And we want to ask you more about Botox now. And who is required to do Botox, and what age do you recommend them to seek it, and how do they go to and treat it?
The right candidate for Botox is the patient having kinetic wrinkles, regardless of the age. Okay. Yani once kinetic wrinkles develop, even in 20s, Botox should be started. That's why Botox is not related to age.
All right.
We should treat kinetic wrinkles to avoid development of static wrinkles, which are more difficult to be treated and may need other procedures to perfectly treat it.
Okay, and doctor, I'm sure there's a lot of misconceptions about Botox from the people and the people who don't know about it, like me. And what are the most misconceptions about Botox?
The first misconception is that Botox causes a frozen look. It's not true. Okay. If Botox is injected by the correct doses in the correct areas of the face, the natural look will definitely be the result.
All right. And if somebody starts seeking Botox, how usually does he come to the clinic and repeat the same treatment? Or is it a lifetime treatment? Or?
Yes, it should be repeated every 4 to 6 months. Okay. On average 2 to 3 times per year.
All right, 2 to 3 times per year.
Yes.
That's not a lot, doctor?
No. It's a repeated procedure.
Okay.
Because muscles return to its activity again after 4 to 6 months.
All right. And doctor, I want to ask you more about Botox. Is it only for wrinkles, or does it prevent any other treatment?
Botox has purposes other than wrinkles, like treating hyperhidrosis in areas like underarms, feet, and hands.
Okay.
And even scalp. Yes.
All right. So that's really interesting. There's a lot of people that come and seek Botox, not just for wrinkles, but for other things too, yes?
Yes. Has many uses.
All right. And doctor, we want to move to the fillers part. I'm sure this is the ladies section, right?
Yes.
Tell us more about the fillers and what are they made of?
Most fillers in the market are made of hyaluronic acid. Okay. The only one which is made of calcium hydroxyapatite has many uses other than filling, like biostimulation.
Okay. And this differs from the Botox chemical, right? The ingredient?
Yes. Hyaluronic acid fillers only for filling and treatment of wrinkles. Calcium hydroxyapatite can be used for filling, for definition, and it can be used as a biostimulator according to each patient assessment.
All right, doctor. And since we're still talking about the Botox, how can people benefit from it and also seek treatments in filler? Can they mix the two?
لا يعني هو most patients mix Botox and fillers because we should treat the face as one unit. We treat wrinkles in the upper face by Botox. Mid and lower faces are injected by fillers. The Botox, the face is a one unit, should be treated at all.
All right, so doctor, let me ask you this. Now a customer walks into your clinic and she's asking for consultations.
Yes.
And what kind of consultations do you give her? Do you give her based upon appearance, or if she's asking for something certain?
Most of times, according to my assessment.
Okay.
Not the patient desire. Sometimes they want something not suitable for them.
All right,
Yes.
and therefore you take on the procedure. It's not a surgical procedure, right?
No, it's non-surgical procedures.
Okay,
Yes.
and usually how long does the Botox last in the skin, and how many days does it fulfill its priority?
Botox starts to act on the third to fourth day after injection, and the final action after 2 weeks. It lasts for 3 to 6 months according to each patient.
Okay, and doctor, I want to ask you this. I'm sure some of our dear viewers have went to doctors and they got mistreatment from either Botox or filler. Can this be fixed?
Sometimes, according to the case. Each case is different from another.
All right, so based on their approach to your clinic, you give them the right treatment plan, right?
Yes, yes.
All right. What about that, dear viewers? Dr. Alyaa Farouk is here to explain to you all about fillers and Botox, and maybe you can benefit from it. So therefore, dear viewers, we shall take a quick report with a look at the subject of healthy skin, since we're talking about dermatology. So let's see this report, and we shall be back to ask Dr. Alyaa more questions. Stay tuned. Welcome back, dear viewers, and we are still joined by Dr. Alyaa Farouk, a specialized doctor in dermatology and also a registrar. It's such a pleasure to talk to you, Dr. Alyaa, and kind of experience from you everything about Botox and fillers for us and our dear viewers.
Thank you.
You're most welcome. Therefore, doctor, we know that some of the treatments come with side effects, right?
Yes.
And what are kinds of steps that people can take to minimize the side effects?
Well, the most common side effects after injections are edema and bruises. The patient can minimize these side effects by stoppage of vitamins, omega-3, analgesics, and anticoagulant therapy 1 week before starting the injection. Okay. Also, after injection, we can apply topical creams containing arnica to treat wrinkles. And in some cases, we can prescribe anti-edematous drugs according to each patient severity.
All right, so a patient, before he comes to your clinic, there are certain procedures they have to do in order to get the right treatment and minimize side effects.
Here, stoppage, the most important thing is stoppage of any therapy can increase bruises and edema.
All right. What about people with oily skin like me?
No harm.
No harm at all.
No harm
That's
at all.
great to know.
Okay.
And doctor, we've seen a lot in social media and trends and people trying to seek, like, you know, the celebrities or a certain actor, they want the certain look. Do you have this option to give it to them?
Yes, I prefer the natural look. By applying small amounts of fillers and Botox in the correct areas in the face to have a natural look. By the way, the natural look is the most recent trend nowadays in 2026, and you can see that on social medias, especially on Instagram, many videos encouraging women to have a natural look.
Okay, and
not overdone appearance as it was the trend in the last 10 years.
All right, I'm sure these girly trends change from time to time, as you said,
yes.
Doctor. So here comes your part. How do you maintain the client when they come, and how do you provide your options for them to be looking natural more?
For example, I apply small amounts of soft fillers. Yes. I must choose the correct type according to the area injected in the face. Small amounts of soft fillers in under eye area and lips in 2 to 3 sessions, not in 1 session, to ensure the natural look development after injections.
All right. And what if a client comes and says, I don't want the natural look, I want to look like this celebrity or this actor?
If it's suitable to her face, I can do. If it's not right for her, I will not do. Some young girls seek for Russian lips and it's not suitable for them. I refuse.
All
Okay.
right. So you do refuse the clients that come and ask you for certain
If it's
procedures?
if it's not suitable for them. Yes.
Right. And have you had, could you give us an example, like this case really happened in the clinic and somebody wanted to look like somebody else and you refused and you told her something else?
Young girl is having a small face, small face. Russian lips aren't suitable for them.
All right.
This is the most common thing happens in the clinics. Yeah.
Okay. And maybe therefore, if you refuse them, do they go to another clinic and also ask there, or you give them?
Up to them بقى. I refuse.
All right.
Okay.
All right. So, Dr. Alyaa, what do you recommend for patients seeking a qualified dermatologist? What do they have to look for in the doctor himself, or the experience does he have?
They must look for a doctor specialized in dermatology or even plastic surgery to ensure having safe injections. Also, they must look for doctors with good reputation. Right. They can ask and ask until they choose the perfect doctor for them. And they can see the photos on their social media. Okay. And the doctor's social media to choose the perfect doctor for them according to her work before and after on social media.
All right. So if they go to the doctor's page and they see a certain photographs that maybe this suits them or it doesn't suit them.
They help them a lot. They help them a lot.
It helps for examples, right?
Yes, yes.
All right. And so, doctor, since mashallah you come with experience from, as you said, you come from Egypt with all your experience in medicine and dermatology. What are the latest trends in innovation or technology that is applied in cosmetology?
Biostimulators and skin boosters. And this is make us sure that the natural look is the demand nowadays, especially into 2026. All patients prefer skin boosters and biostimulators, not fillers, like the trend in the last 10 years.
All right. So these fillers are, as you said, the ingredients inside the fillers and the Botox, have they came to innovate them? Like, is it something new rather than before?
They complete each other. يعني biostimulators decrease the number of filler syringes needed for the patient. That's why all patients prefer biostimulators and skin boosters before filler injection.
All right. And doctor, I've heard some family members of mine that when they seek the dermatologist, they go for something related to omega oils or fish oils.
Yes.
How do you see this, or how do you explain it to people that there is another also treatment?
Yeah, the omega-3 and omega oils are not an alternative for non-surgical injections. Okay. It can benefit the skin, but it's not an alternative.
All right.
Non-surgical procedures have no alternative.
All right.
Okay.
All right. That's great. And as you said, people or patients have to come prepared for the treatment, yes?
Patient to have a healthy skin, patient should follow many steps. The first step is skin care routine, especially sunscreen, taking vitamins to ensure having a healthy skin. And in case of wrinkles development, we can perform non-surgical injections. They complement each other, no alternatives.
All right, all right.
Yes.
And doctor, I want to ask you, for people to avoid wrinkles, do they have to express less, for example?
No. Applying sunscreens, having a healthy lifestyle, healthy food, going to gym continuously, all these benefit the skin. In case of development of wrinkles, earlier we do non-surgical procedures, not in an old age, after development of static wrinkles. In this case, non-surgical procedures aren't enough. We will need surgical operations. We will need surgical operations.
All right. So as you said, non-surgical comes from food?
20s, 30s. We must start these procedures in an earlier age.
Okay.
Yes, yes.
All right. And doctor, do you see a lot of males approaching also your clinic?
Botox.
For Botox?
Yes, yes. Many men like Botox because they express a lot.
All right.
That's why they need Botox all the time.
All right. And if a male, for example, seeks your clinic and goes for the Botox, how many times does he come a year? As you said, 3 months, every 3 months?
4 months. because they have powerful muscles.
All right.
They
So,
come 3 times per year.
okay. So,
Yes.
as you said, there's something related to the muscles and between female and male.
Males have strong muscles.
Okay.
Females have weak muscles. That's why men perform Botox regularly, يعني every 4 months.
All right.
Yes.
And doctor, going for the non-surgical parts, as you know now, there's a spread of collagen, they say, or something, or an ingredient called collagen, like scrubs, pills. What do you recommend?
Collagen pills can complement non-surgical procedures, not an alternative. All supplements and the skincare routine help me have a healthy skin with non-surgical procedures, not an alternative.
All right, and as you know, doctor, we live in Kuwait. The sun is pretty heavy in the summer.
That's why sunscreen is very important.
So what's the pH of the, or what's the level of the
50
sun?
plus. 50
We have to
plus
take
more
50 plus?
Yes, yes.
Wow.
All sunscreens nowadays are 50 plus.
Okay,
Yeah.
okay.
And they should apply it every 2 hours, especially in chronic exposure to sun.
All right.
Yes.
And do you have any last message, Dr. Alyaa Farouk, for us and our dear viewers watching us today?
The patient should start non-surgical procedure earlier, especially Botox. يعني earlier in case of development of kinetic wrinkles, before wrinkles become severe.
Okay.
This is the only message I wanted to say to all patients.
All right.
Especially
and when should they, doctor, when should they approach the doctor exactly?
When kinetic wrinkles start to appear, fine wrinkles start to appear, not deep wrinkles.
All right.
Yes.
All right. Thank you so much, Dr.
You are
Ali, for
welcome.
joining us
You are
here on Hala Kuwait and kind of explaining a lot of insights about dermatology, Botox, and fillers for us, and I'm sure our lovely viewers watching us today.
Thank you, thank you.
You're most welcome. Therefore, dear viewers, let's all thank the coming of Dr. Alyaa Farouk, specialized in dermatology and also a registrar here in our beautiful state of Kuwait. Therefore, dear viewers, we shall take a quick break with this report about photography, so stay tuned and we shall be back.